Welcome to the deep dive. Today we're tackling nasal polyps. Might sound technical, but maybe more familiar than you think.
That's right.
You've shared some really interesting info on these growths. Our mission today is to unpack what they are, maybe why they happen, and why they can be so persistent.
Exactly. And we'll try to cut through the jargon, focus on what's most important.
Yeah, we know people want those aha moments, quick but thorough. So, the sources cover the basics, right? Definition, how common, symptoms.
Yep. Definition, prevalence, symptoms, potential causes, associated conditions. It's all in there.
And what jumped out at me straight away is that even though we've known about them for ages and researched them a lot,
Yeah.
the exact why is still a bit elusive. It's kind of a puzzle.
It really is. One of the fascinating things we'll get into.
Okay, let's dive in. So
Yeah.
basically, what are nasal polyps? Like in simple terms.
Okay. So fundamentally, they're the end product of long-term, chronic inflammation, specifically in the lining of your nasal passages and
The
sinuses.
sinonasal tract.
That's the one. Think of it like a constant irritation leading to a specific kind of swelling or growth.
So it's not just any swelling.
No. It's actually classified as a specific type of chronic rhinosinusitis. We call it chronic rhinosinusitis of polyps. CRSWNP for short.
CRSWNP. Got it. So a long-term sinus issue that results in these polyps.
Precisely.
Now, you mentioned there are guidelines, European guidelines for defining this. What are doctors actually looking for?
Right. So the guidelines say, look, it's inflammation of the nose and sinuses, and you need at least two main symptoms.
Okay.
One of those has to be either nasal blockage, feeling stuffed up, congested, or some kind of nasal discharge, like a runny nose.
Blockage or discharge, one of those.
Yes. And then alongside that, you might also have facial pain or pressure or a reduced sense of smell, maybe even completely lost.
Okay, so two symptoms, one being blockage, discharge, the other being pain, pressure, or loss of smell.
Correct. And then to confirm it's specifically CRSWNP, the doctor needs some evidence, either seeing the polyps directly with an endoscope.
Like a small camera.
Exactly. Or seeing signs like thick, discolored mucus, what we call mucopurulent discharge or specific swelling, edema, in an area called the middle meatus.
Mm-hmm.
Or sometimes changes on a CT scan showing problems with the sinus lining.
Okay, so it's a mix of how you feel and what the doctor can actually see or detect. Makes sense.
Yeah.
Now, the polyps themselves, what do they actually look like? Are they hard?
Good question. Actually, they're usually described as edematous, which just means swollen with fluid.
Ah,
Think of them like, well, the description often used is like small, translucent grapes.
peeps? Really?
Yeah, kind of hanging there in the nasal passages, usually in the upper part near a key drainage spot called the osteomedal complex.
Okay.
And they tend to look smooth, pale, sort of see-through. That helps distinguish them from the normal pink lining of the nose, which has more blood vessels.
Interesting. Pale and translucent, not pink. And you said is it usually more than one? Both sides?
Yeah. Yes, typically bilateral, so affecting both sides of the nose. If you see a polyp only on one side, that's less common and usually makes doctors think, okay, let's rule out other things just to be sure.
Right. It's definitely a polyp and not something else. That grape image is much clearer now. So they're soft, fluid-filled.
Pretty much, yeah.
How common are these then? Is this something lots of people get?
It's actually more common than you might think. The number of new cases each year, the incidence, is somewhere between 1 and maybe 20 per 1,000 people.
Okay.
Though interestingly, that rate tends to go down a bit after age 60.
Ah,
And if you look at how many adults have them at any one time, the prevalence, it's around 1 to 4%. Much lower in kids, though, only about 0.1%.
wow. Quite a difference between adults and children.
It is.
Yeah.
And there's also a gender difference. Men are more likely to get them than women, maybe 2 to 4 times more likely.
Really? Any idea why?
Not definitively, no. And interestingly, there doesn't seem to be any particular racial group that's more prone to them. But here's a really key point. Certain other diseases, systemic conditions that affect the whole body, are linked with a much, much higher chance of developing nasal polyps.
Ah, okay. That is interesting. Makes you think about those underlying connections, doesn't it?
Absolutely.
So if someone does start developing these, what would they typically notice first? What are the symptoms?
Well, it can really vary, mainly depending on how big the polyps get. If they're really small, you might not notice anything. They could just be found by chance, incidentally.
Right.
But as they grow, symptoms usually creep up gradually. Maybe it starts with just a bit of nasal stuffiness, a watery, runny nose,
Uh-huh.
Then it can progress to more persistent blockage, feeling really obstructed, and often a reduced sense of smell that's hyposmia, or even losing it completely, anosmia.
Losing your sense of smell? That must be quite impactful.
Oh, definitely. It affects taste, too, enjoyment of food.
Huh.
People also often get a thicker mucus dripping down the back of their throat, post-nasal drip, and sometimes headaches.
Okay. Now, what about nosebleeds? Are they common with polyps?
That's a really important point.
Mm-hmm.
Generally, no. Benign nasal polyps don't typically cause nosebleeds or epistaxis.
Ah,
If someone is having nosebleeds along with other nasal symptoms, it's a bit of a red flag. It suggests something else might be going on that needs checking out.
that's really useful to know. So lack of nosebleeds is somewhat reassuring if polyps are suspected, but if they are happening, get it investigated.
Yeah, exactly. It's a key distinction.
What if the polyps get really large? Can they cause bigger problems?
Yeah, if they get quite big, they can lead to chronic mouth breathing, especially at night. That can cause sleep issues, like bad snoring or even obstructive sleep symptoms where breathing pauses.
Mm.
And in rare cases, really massive polyps can actually start to change the shape of the face over time. Things like proptosis, where the eyes bulge slightly,
Oh,
or hypertelorism, where the eyes look wider set. Even double vision, diplopia, can happen.
that sounds quite serious.
It does, but it's important to remember this is rare and it happens very slowly. And even when they get quite large, maybe extending towards the base of the skull, they usually don't cause nerve symptoms or significant pain, probably because that growth is so gradual.
Okay, so slow growth means the body kind of adapts, maybe, less likely to cause acute pain. That's somewhat reassuring.
Generally.
Right. Let's get to the big question, though. The origins. Where do they come from? We know the exact cause is fuzzy,
Mm.
but what's the current thinking on how they actually develop? The pathogenesis.
Okay, so the general understanding is that polyps develop where there's chronic inflammation.
Mm-hmm.
It's thought that various triggers, and we'll get to those, lead to this sort of dysregulated interaction between the sinus lining, the epithelium, and the immune system.
So the communication goes wrong somehow.
Kind of. And if you
Mhm.
look at a polyp under the microscope, what you see is mostly loose connective tissue, lots of inflammatory cells, quite a bit of fluid, all covered by that special airway lining, pseudostratified, columnar, ciliated epithelium. Physically, what seems to happen is that this swollen, fluid-filled connective tissue basically pushes through, it breaks the basement membrane, which is like a supporting layer under the lining.
Like a bulge forming.
Exactly. Like a persistent leak causing the wall to bulge out.
So we can see how it happens physically, but the initial spark, the trigger for that inflammation, that's the unknown bit.
That's the core of the mystery, yes. Despite tons of research, there's no single definitive cause identified.
Hmm.
Things like bacteria, fungi, allergens, even something called superantigens. They're all thought to potentially play a role in starting or driving the inflammation.
Superantigens, what are they?
They're substances that can basically kick the immune system into overdrive in a very nonspecific way. But yeah, whether it's one of these or a combination or something else entirely, the primary trigger often remains unclear.
It really shows how complex our immune system is, doesn't it?
It absolutely does.
Yeah.
And how it can sometimes go a bit haywire.
Now, your sources mentioned some newer findings about the type of inflammation. That sounded important.
Yes. This is where things get really interesting, potentially for future treatments. It turns out, particularly in Western countries, about 80% of nasal polyp cases show a very strong, specific type of immune response. It's called the T helper 2 or Th2 response.
Th2 response.
And this involves having lots of a particular white blood cell, the eosinophil, infiltrating the tissue.
Eosinophils. Right.
There also seems to be less activity from T regulatory cells, which normally act like brakes on the immune system, and high levels of a specific signaling molecule, a cytokine called IL-5.
IL-5, and what does that do?
Think of IL-5 as a key signal that specifically calls in more eosinophils. So it kind of ramps up this specific Th2 type inflammation.
Ah, so it's like a vicious cycle.
Yeah.
IL-5 brings in eosinophils, which cause inflammation, maybe triggering more IL-5.
That's part of the thinking, yes.
Yeah.
This strong Th2 signature with eosinophils and IL-5 is a major characteristic in a lot of polyp cases, especially here.
That feels like a really significant clue. It points towards a specific pathway being overactive.
It does. It's a major focus of current research and treatment development.
Okay. So, moving beyond the biology, what's the overall impact of having nasal polyps? The sources mention a burden. What does that mean?
Yeah, it refers to the wider impact. Obviously, for the individual, it significantly affects quality of life. Sleep, smell, taste, concentration, just general well-being can all take a hit.
I can imagine.
But there's also a big societal burden. Think about the direct costs. Doctor visits, prescriptions, allergy tests, maybe CT scans, sometimes surgery and hospital stays.
Right, the healthcare costs.
Exactly. And then there are indirect costs. People might need time off work, or maybe they could work, but they're less productive because they feel unwell or congested all the time.
Yeah, that makes sense. So it adds up both personally and economically.
Definitely. And adding to that burden is the fact that CRSWNP is often chronic and, frustratingly, can come back even after treatment.
Oh, really? So treatment isn't always a permanent fix.
Unfortunately, not always. It can be a recurring condition for many people, which adds to the long-term challenge for both patients and doctors. As the sources point out, it remains a pretty significant issue in medicine.
Okay. So let's try and wrap this up. This deep dive really shows that nasal polyps, well, they're way more than just a blocked nose, aren't they?
Absolutely. They're a sign of complex chronic inflammation in the sinuses. Often, though not always, driven by that specific Th2 immune response we talked about.
And while we know what they look like, how common they are, the symptoms, the root cause is still being chased down.
Precisely. We understand the what and the how common pretty well and how they present, but the fundamental why is still the subject of intense research.
And they clearly have a big impact personally, financially, societally.
No doubt about it.
So you leave with a much clearer picture, hopefully, what they are, who gets them, what it feels like, and this ongoing scientific quest.
Yeah, that covers the key takeaways.
Which really makes you think, given that strong Th2 link in so many cases, especially with the eosinophils and IL-5, what could future research focused on targeting that specific immune pathway unlock? Could we see therapies that really get to the root of it, maybe preventing them or managing them much better long term?
That's exactly where a lot of hope lies. Developing more targeted therapies based on understanding these specific inflammatory pathways is a very active area.
Fascinating stuff. Well, we hope this deep dive has shed some light on what can be a confusing topic. Thanks for joining us.